What I've really focused on in my career to date has been the concept of balancing identity and beauty.
You are the only female plastic surgeon in New York City that has sort of gotten the accolades that you've gotten.
So some of my main contributions in my field to this point have been the concept of non-surgical rhinoplasty, the concept of facial optimization, the concept of a running intracuticular zip stitch for blepharoplasty. And then in my practice overall, I've really tried to balance the surgical with the non-surgical. And that's not as common as you might think, but that's what allows me to give patients the most bespoke and customized results. To me, it's the perfect blend of art and anatomy.
This is Get Well Better, a podcast by The Land Bee. I'm your host, Chloe Harrouche. Today on Get Well Better, we're joined by world-renowned plastic surgeon, skincare entrepreneur, and thought leader, Dr. Lara Devgan. She's the founder of Dr. Lara Devgan Scientific Beauty, known for science-backed skincare that actually works. And she's celebrated for her natural, elegant approach to cosmetic treatments. A Yale and Johns Hopkins trained surgeon, mother of 6, and fierce advocate for women's empowerment, Dr. Devgan is redefining beauty through the lens of identity, anatomy, and innovation. Let's dive in. So, Dr. Devgan, very, very happy to have you and excited to jump into so many different things. I really want to talk about skincare. It's something that I know very little about as someone who's passionate about health and wellness. Skincare is not one of the verticals that I'm familiar with or comfortable talking about. So bear with me as I ask you probably some pretty rudimentary questions, but also talking about routines, trends in sort of the world of plastic surgery, and any expert advice you can share.
Well, thank you so much. I'm so thrilled to be chatting with you, and I can't wait for a great conversation.
So I'd love to start off by talking a little bit about your career trajectory, because it's obviously not often that a plastic surgeon turns skincare founder, for one, but also just even focusing on your surgical practice alone. You are one of the only, I think the only female plastic surgeon in New York City that has sort of gotten the accolades that you've gotten. Like it's pretty remarkable, the career that you've established for yourself, the name you've built for yourself. And so I want to just hear from your own words, like how you got here. Like, what do you think set you apart, set your practice apart, your philosophy apart?
That's such a nice compliment. Thank you so much. Well, I really love what I do. I feel incredibly fortunate every day to be able to combine art and anatomy in the way that I do. But I grew up in Southern California as a classically trained artist, and I always had in my mind that aesthetics and light and shadows and the human form and angles and elegance was something that I just thought was so beautiful and interesting. And as I grew up, I became more and more interested in science, anatomy, tissue planes, dissection, how we can think about physiology and science and anatomy together. And I went to college at Yale. I studied English language and literature, but at the same time was pre-med and did research in one of the amazing biochemistry labs there under Robert McNabb, who's a Nobel laureate and an incredible guy. And that led me then to medical school at Johns Hopkins, where I found so much respect and admiration for the surgical pioneers in front of me who had come before. Hopkins is a place that is not only an amazing medical school, but it's the home of Halsted and Osler and these hallowed hallways where these surgeon scientists did the most amazing things. And I was fortunate to see free tissue transfers and microsurgery and the intricacy of reconstructive surgery. It really made me appreciate the blend of aesthetics and anatomy in complex plastic and reconstructive surgery. I then went on to do a National Institutes of Health T32 predoctoral clinical research fellowship, where I studied surgical outcomes research. And then through Hopkins, I also got a master's degree in public health, studying epidemiology and biostatistics. So I have a very technical background. I came to New York City in 2007 to work at Columbia, Cornell, New York Presbyterian Hospital, where I did my plastic and reconstructive surgery residency and fellowship. And that was just an amazing experience. New York City, I may be a little biased, but it's the best city in the world and so busy. And there's so much to learn as a young surgeon scientist. And so I studied and performed many complex operations, including burn surgery, cancer reconstruction, facial trauma reconstruction, congenital anomalies, free tissue transfers, microsurgery, hand surgery, craniofacial surgery, the full breadth and depth of plastic surgery, and had the opportunity to work with and shadow and observe some of the true pioneers in facelift and cosmetic plastic surgery. So that all led up to me starting my own private practice in 2013. So it's my 12th year now of my private practice in New York City. And I think what I've really focused on in my career to date has been the concept of balancing identity and beauty. And how do we borrow from this totally academic background where anatomy and science rules the roost with the idea of integrating that into aesthetics and beauty and facial optimization. So some of my main contributions in my field to this point have been the concept of non-surgical rhinoplasty, the concept of facial optimization, the concept of a running intracuticular zip stitch for blepharoplasty. And then in my practice overall, I've really tried to balance the surgical with the non-surgical. And that's not as common as you might think, but that's what allows me to give patients the most bespoke and customized results. So I like to be fully vertically integrated. And then the skincare line was the natural outgrowth of that, because not everyone wants a facelift. Some people just want some Botox, and not everyone wants Botox. Some people just want a topical product, a retinoid, retinol skin cream. And how do we integrate them all together? So that is kind of my life in a nutshell. It makes sense for me because to me, it's the perfect blend of art and anatomy. And I love
No,
every
when you
minute of it.
describe it in that way, it does make perfect sense. Like, your background and sort of the confluence of your passions have all sort of naturally evolved to give you this expertise. And actually, they say when you're trying to find your path, you should really think about what is play for you but work for other people. And it's very clear that this is not work for you. Like, this is your passion. You love sort of the intricacies of biology and chemistry and anatomy with the sort of art. And I think plastic surgery is one of the few specialties within medicine where you have that free play, that artistic contribution.
The work is so
Right.
visible.
Exactly.
Yeah, go
Exactly.
ahead.
And I think it's the only place where you're actually talking about beauty in the conversation, and you can be vain in the conversation with your surgeon. And every other conversation with your doctor, it's all about health outcomes, right? Like, this is the one time where you can be, honest about what you want to look like or what you don't want to look like. So as you think about facial optimization, like, does the conversation of like what defines beauty ever come up? Like, do you have a perception of what beauty should be, and how does that compare to how other people perceive their own beauty? Or do you just sort of let people decide what they want to look like? Like, how do you think about sort of what the before and after should be as you think about facial optimization?
It's such a great question. I love thinking about stuff like this. Okay, so first of all, I think what I do is much more about identity than physical attractiveness, because ultimately the problem that we're trying to solve is how do we have the outside reflect the inside? Sometimes people feel like they're alert, but they look tired, and that ego dystonic feeling is what drives someone to do a blepharoplasty or tear trough augmentation or buy a peptide eye cream. So it's a little bit less about the end result and more about the feeling that is starting it, and making it all make sense is my job. And so in terms of what is beauty, what is attractiveness, there are some basic principles that I think we can think about when understanding facial harmony. And those include the balance and harmony of the features with respect to each other. So every anatomic area bears on the adjacent anatomic area. We can look at things like waist to hip ratio, the balance between the zygoma or cheekbone and the mandible or jawline. We can look at the balance between the nose and the chin. We can look at the lights and shadows as they hit the face. We can try to correct for symmetry. Every single feature on the face has an absurd quote unquote aesthetic ideal, down to the eyebrow, where you want to see the arch of the eyebrow halfway between the lateral limbus, which is the edge of your iris, and the lateral canthus, which is the corner of the eye. So there are many textbook definitions of what beauty is according to concepts of facial harmony that derive from the golden ratio. And, it harkens back to Michelangelo and before that. However, in real life, it's not that you have to look like a textbook to be happy. It's a combination of understanding somebody's concerns, understanding what I can do to help them mitigate those concerns, and then how do we meet in the middle. It's almost like heel height or lipstick shade, where maybe there is a heel height that will empirically flatter that dress length the best. How many blocks are you walking? Are you carrying shoes in your bag in the subway? Is that a comfortable heel height? Do you like the color? So with my work, I almost think of it like commissioning an artist to make a very beautiful and very high stakes painting for you, where you need to like the artist's work, you need to appreciate the hand of the artist and their expertise and opinions, but you need to bring to the table your own thoughts and preferences and feelings, your goals, your budget, the areas that are of interest to you. If it's a blue couch, you want a blue painting so that it looks good above it. There is a collaborative process with the best patient experiences. That's something that I try to bring into the consultative experience with my
So
patients.
is it safe to assume that when it comes to facial optimization, you have patients that are coming in almost not knowing what they want, but they want you to take a look at them and say, optimize me, like look at sort of my features and how do you think I can improve? And then you basically recommend
That's
based on their budget. If you were to go into any plastic surgeon's office and say that, what would their reaction be versus your reaction?
not sure. Yeah, I'm not sure. I think that what I try to do is to get away from the feeling that I think we grew up with in the 80s and 90s, where beauty was self-abnegating and everyone felt bad about themselves because of the extent to which they fell short of what magazine covers looked like. To me, that's not part of my worldview. I want any experience that someone has with an elective cosmetic plastic surgical procedure to feel empowering. They're getting closer to the version of themselves that makes them walk taller and feel more confident and be more effective as a person in the workforce, as a friend, a daughter, a mother, a brother, a father. So I'm not sure what other people do. I know what I do in my practice is talk to a patient about their concerns, do a facial analysis or body analysis if we're talking about breasts or body contouring. We analyze the anatomy. We always talk about anatomy. I love talking about anatomy. Then we talk about what's possible and not possible. I think in pop culture we've gotten this very strange sense that plastic surgery is magic, but really what I do is medicine and not magic. And so all procedures have limitations. Some procedures are better suited to other patients and not the patient right in front of me, and vice versa. And so it's important to have that feedback. And then we kind of embark on a journey. But it's very common for patients in my practice to want to look like a better version of themselves and not
Right.
like someone else. And so I like to think that many of my patients appreciate my advice and
Yeah.
opinions about that.
Can we talk about the non-surgical rhinoplasty, like the nose jobs, right? Like I
Love
need to
it.
understand
Yes.
how that works because I've seen so many before and afters, and I do not comprehend how it's possible to achieve that result without surgery. Can you talk a little bit about how you even came up with this approach and sort of what it entails?
Yes, and this is the coolest. Non-surgical rhinoplasty is maybe the most gratifying tiny little procedure that I'm capable of doing. The concept of non-surgical rhinoplasty is changing and improving the contour of the nose without surgery. And so the very first iteration of it was described before I was even born. So I can't take credit for thinking about the idea of putting a thing in the nose. However, the modern non-surgical rhinoplasty is a procedure that I worked on starting in 2013 when the newest generation of hyaluronic acid-based fillers came to market. And the idea of this procedure is that we're using micro droplet injectable hyaluronic acid-based filler to change the structure of the nose. If you think about the nose, the nasal pyramid, kind of like a tent, you can adjust the tent poles and that will change the way the canvas redrapes over the tent. So in effect, what I'm doing is using minuscule amounts of filler to act as if they were a surgical cartilage graft to change things like the straightness of the nasal dorsum, the refinement of the nasal tip, the elevation of the nasolabial angle, the coherence of the nose as a whole, asymmetry, correction of prior surgical problems, all of the above. So it's a very cool procedure. There's no downtime, and patients have been known to have tears of joy as a result of this little procedure. But so, I've done more than 20,000 of these, which I think is more than anyone in
Wow.
the world. I think that it is a procedure that has changed plastic surgery hugely because many people are taken out of the pathway of surgery because they're very happy with their non-surgical rhinoplasty
Is anyone
results.
not a candidate for that type of procedure?
Yeah, non-surgical rhinoplasty is best for patients who have a dorsal hump or bump on their nose, a droopy nasal tip, asymmetry or irregularity. It's not powered to make the nostrils smaller or to reduce the alar base of the nose or to subtract. So, somebody who wants a subtractive effect is fundamentally going to need surgery. In addition, non surgical rhinoplasty is not permanent. Patients are maintaining this once or twice a year. And so, somebody who doesn't like that concept of maintenance may be better suited toward a surgery. And then finally, if you have functional nasal problems like deviated septum, enlarged turbinates, difficulty breathing, often surgery is the best approach to address that along with aesthetics at the same
Okay.
time.
Wow. Mind blowing. So before we jump into skincare, because I feel like most of the conversation will end up being about that, but I wanted to get your thoughts on, if you are someone who's exploring plastic surgery, whatever it may be for, what do you think are questions that should be asked that most patients don't ask, that anyone should, incorporate into their sort of consultation process as they're getting to know different surgeons?
I think some of the most important things to consider are, first of all, are you talking to a board certified plastic surgeon? This may seem extremely obvious, but it's not. And some of the loudest voices on the internet, including platforms like Instagram and TikTok, some of the loudest voices in plastic surgery are not board certified plastic surgeons. And so, first and foremost, at a bare minimum, you want the safety that is implied with extremely rigorous training over decades. That's how you can put buffers on whatever happens. You know that you're going to be treated by somebody who has ethics training, anatomy background, and the ability to keep you from harm. It's like when you're flying on a plane. The pilot has to at least have gone to pilot school and have a pilot's license. That is a bare minimum. I think beyond that, once you've done that little fact check step, you want to make sure that you've reviewed somebody's before and after images. You want to make sure that you feel that you can have a collaborative relationship with that person, because as I mentioned, it's very much a dialogue. They're two people trying to arrive at a successful outcome. So it can't be a situation where you feel like somebody is not listening to you and not respecting you and not hearing you. You have to have a collaboration in mind. Next, I think it's very important to understand patient feedback. I think reviewing somebody's presence on social platforms and understanding if you feel a click and connection is important. I think there are other little things that can be helpful to take in and understand, like, is the office environment clean? Is the staff kind and compassionate? It's like that adage that when you want to understand if a restaurant is a nice restaurant, you like go to the kitchen and the bathroom, and that'll give you a little sense. I think you want to understand if the front door glimpse that you get of a person and their practice is a good
Mm-hmm.
fit for you. And so those are some of the most important things to think about in conversations about surgery. I always want to make sure that I'm counseling patients about not just the goals of the surgery, but also the risks, the benefits, the alternatives, and the indications for a given procedure. And it's important to understand that even though plastic surgery does sometimes feel like a magic wand, there is an element of maintenance that is necessary for everything. Just like you can't take your car to get a little tune up and an oil change exactly one time. There's going to be a little bit of maintenance there. The skin, the hair, the nails, these are rapidly dividing cells, and continued maintenance is what allows people to feel fresh over time.
That's good advice. Hey guys, briefly interrupting this episode to let you know that Dr. Lara Devgan is offering a 15% discount to her skincare line. Head over to drlaradevgan.com and use code THELANBY. Are there any treatments that you think sort of don't merit the hype?
Yeah, there's so many. There's so many. There's a lot of hype. I'll start by saying that I'm someone who loves the idea of technology. I love being current on the literature, but I'm also a data-driven patient. So I want to see that something works before I do it. I think the treatments that are extremely overhyped are energy based tightening devices. The concept of a non surgical way to tighten the tissues of the face or body, that is the black box of plastic surgery. We don't really have that just yet. And so when you hear about stuff like Althera, Thermage, Morpheus 8, soft wave, these treatments that are essentially radio frequency, these treatments that are essentially adding heat to the tissues in order to denature the proteins for a transient tightening effect, they not only are underwhelming in the sense that they don't work well, but they also can damage your tissues, denature your proteins, cause loss of fat, and make a future surgery more difficult. So I'm not a huge fan of these treatments, and I think people should be extremely wary about entering into that realm.
Okay, so then on the flip side of that, are there other types of treatments that people don't know much about, but actually have significant positive benefits and more people should be considering even proactively?
Yes, I think the concept of neuromodulator, which is the medical term for Botox. I mean, this is sort of a no brainer in this era, but a lot can be achieved with judiciously and correctly placed neuromodulator, including a little bit of a brow lift, an improvement of skin quality, tightness of the neck, slimming of the face, a lip flip, hyperhidrosis, calf slimming, trapezius slimming, postural correction, tooth grinding, migraines. Like there are many things that can be achieved with this simple non surgical procedure. Second, I would say smaller surgeries done at earlier ages can be surprisingly powerful. Like the concept of a facelift in your 40s may seem crazy to the uninitiated, but in fact, doing a more elegant and discreet surgery a little bit younger allows you to harness better healing potential, a smaller scar, better collagen formation, less of a delta or difference between the before and the after, and finally, more quality adjusted life years to enjoy it. And then finally, I would say the power of judicious injectables is vastly underestimated. I think we're having a zeitgeist moment where the internet is questioning the concept of fillers. But what's really happening is that there has been a preponderance of bad work out there that people look at and it terrifies them. I think if we try to act elegant and understated in our approach, a lot can be
Mm-hmm.
possible.
Totally. I mean, that's how it is with everything on Instagram. It like completely skews the pros and cons of any trend. And it makes it really, really hard for consumers to decipher whether something has validity and is something they should explore and who to trust and who not to trust. It's what makes social media and even the internet so dangerous, but yet so equalizing, in a lot of ways. And I think that when it comes to medicine, there's just such greater stakes than in any other discipline where you're trying to seek information from social media. So that's a really interesting point.
Yeah, and the internet is so powerful. I think it's amazing that people have little computers in their purses and pockets. If the cell phone is the new computer, then Instagram and TikTok are the new website. And this is just how we receive information now. And I'm a fan of it. I think the problem is this idea that if you're not at the table, you're on the menu. And as I was saying before, many board certified plastic surgeons just are not contributing enough to the dialogue on these complex anatomic and plastic surgical topics. And the conversation is sort of getting away from us into the realm of clickbait and what's going to go viral for 5 seconds instead of what's accurate. So it's all good, but now more than ever, with the increase in digital noise, we all have to be more savvy and more educated consumers about, consider the source.
Yeah,
Who's talking?
totally. So shifting into sort of your more recent career in the sort of skincare realm, how'd you decide to take that leap? Like, what was sort of the light bulb moment in your head to say, I may not be a dermatologist, which sort of they're notorious for launching their own lines of skincare, but I have a unique sort of philosophy around what, skincare should be comprised of and the ingredients that should be used. I want to build my own line and this is what it's going to be all about. What was that journey like for you?
Well, when we look at the face, when I'm analyzing facial aesthetics, I'm not just looking at the skin, right? When we look at the face, we're looking at all of the layers of the tissue, the bone, the muscle, the fascia, the fat, the soft tissue, and the skin. And so in my practice, I try to be totally vertically integrated to allow myself to give my patients the most and best options. I want to be able to do the most invasive facelift surgeries and also the most minimally invasive injectables and microinfusion microneedlings and PRP and lasers. So topical skincare is part of this equation because the skin is the largest organ on the body and the most visible. And we can harness what we know from plastic surgery, science, medicine, and anatomy to help improve the quality of the skin. I sometimes think when I see my patients that if you're doing laser resurfacing, ablative laser resurfacing a couple times a year, but not optimizing your topical skincare, it's like getting your teeth whitened at the dentist, but then not brushing them every single day. And the power of tiny daily habits makes a tremendous impact on the skin. So my background is as a surgeon scientist, starting from not only biochemistry labs, but surgical outcomes research, the National Institutes of Health, clinical research at all of the most busy New York City-based hospitals, and a patient population where I've done over 100,000 non-surgical procedures and tens of thousands of surgeries. What I want to offer to patients is a comprehensive solution where I'm not just doing somebody's breast augmentation or neck lift and then sending them out into the world to fend for themselves. I want to have an evidence-based, clinically effective approach that fully vertically integrates the other stuff I'm doing. If you have an optimal skincare routine, you can literally reduce the number of Botox units needed to smooth out your wrinkles. And if you are using optimal topical products, a great niacin and squalene neck cream, you'll see less wear and tear on the neck, need less microdosed filler in your horizontal necklines, need fewer neuromodulator injection sites, defer the need for a surgery. Everything relates to everything else. And I think this is my passion for skincare. And this is the reason why 5 years ago, I started my skincare company. I really felt there was a dearth of options, and the options that existed were in the context of people being at war with each other, where there's this battle between dermatologists and plastic surgeons and, have a surgery, nope, have a filler. What really is best for the patients gets lost in the sauce when you have a situation.
So what are some of the basics that, okay, let's look at your skincare line. Where should someone start? Like, you have obviously incredible products, and maybe one is going to be better fit for one because they already are noticing wrinkles on their neck. And so they want to start with the neck cream versus the peptide eye cream. But how did you think about the product line, and what should everyone start with and then potentially graduate to as they think about optimizing their skin routine?
So if you are very uninitiated and you want to start a medical grade skincare routine, the most important three products are our serum superheroes, which are a hyaluronic niacin panthenol serum in the morning. And that is excellent for barrier protection, hydration, collagen induction, and nourishment of the tissue. Remember, collagen is our natural resource and we want to hold on to it. It's like the trees and the leopards that are becoming extinct. We need to keep our collagen. So that's the hyaluronic niacin panthenol in the morning. And then at night, we want to use our vitamin CBE ferulic serum, which is an amazing antioxidant and brightener to help with skin quality, brown spots, melasma, discoloration. This is a product that's very cool because not only is it a 25% vitamin C, which is a higher percentage than all our major competitors, including SkinCeuticals and SkinMedica, but it's also a gentle product that's suitable for all skin types. And it scavenges environmental damage that you get from oxidative tissue exposure when you're out in the sun. So it's an incredible product. And then right after that, our retinal bakuchiol serum, which is a combination of retinoid, retinaldehyde, and bakuchiol, which are ingredients that basically improve skin cell turnover to get rid of fine lines. So if you want the top 3 recommendations that I have and you don't want a complicated routine, those are the 3 most essential products, and you can kind of patch the rest together with, you know, a bar of soap and like some shampoo and whatever else. If you have more complex needs or you have more mental bandwidth for a more
Mental
medicalized
bandwidth is
approach,
key.
there's a huge opportunity. Yeah, I mean, it's a lot. I'm a realist, so I understand that people want fewer, higher quality, more multifunctional products. And so that's why all our product names are kind of a mouthful, because they are truly packed with high potency, high percentage
Mhm.
active ingredients. But that's the way that we can get people the most efficient solutions. If you're still with me after that huge long paragraph I just delivered, you could try our polypeptide eye cream to improve the turgor of the tissues around the eyes, our nice and squalene neck cream to help with the neck, which is an axial joint that has so many movement demands, our resveratrol and niacinamide rich cream, which is amazing for supporting tissue health for the whole face. And it's a little bit of a thicker product for more sensitive skin. I mean, there's a lot. I think our most cult favorite products, the ones where we've sold the greatest number of units, like over 1 million units sold, a platinum lip plump, which is our medical grade lip plumping
Wow.
gloss, and our lash serum, platinum long lash, is also extremely popular. It's a prostaglandin free alternative to some of the other lash serums on the market. Prostaglandins are a drug that can cause fat atrophy and discoloration around the eyes. So we wanted to create a product that was free of those ingredients that would still give you long, beautiful lashes and eyebrows without causing
And that
problems. So
eyelash, the
those are
eyelash
some
one
of
and the
my
eyebrow one, those are ones that you have to continue using in order to continue seeing results.
exactly, they would revert back. It's like, you know, with the eyelashes, it's like the hair on your head. If you were to dye your hair a different color and just leave it alone, it would eventually go back to how it used to be. And it's the same with anything in that
When
category.
you were thinking about the ingredients for these products, did you struggle at all with this concept of clean beauty and like what even constitutes clean beauty? Because I know that there's a lot of products, like for example, for me, I have very sensitive skin. And when I use clean beauty products, oftentimes I get more irritated than when I use dermatologist approved products that are not necessarily like fully clean, but are safe, you know, in terms of allergic reactions. Like, how did you think about that? Or maybe it wasn't really part of the equation for you, but I feel like maybe because you see it all the
No,
time.
I think the 2010s era forced everyone to learn this term that is a fake term, clean beauty. It's not my favorite term because I think there's a lot of consumer confusion. I think some of the quote clean beauty products are the actual dirtiest products on
Yes.
the market from a medical science standpoint, because some people will use the term clean beauty to mean that the products are preservative free, which makes them a hotbed for microbial infestation. And so, you know, preservatives are our friends. I know that people get scared about chemicals, but chemicals are okay. They help us. It's like pasteurizing milk. That's a very artificial process, but it's saved millions of people from listeria infections. So we need to use modern medicine and science to help us. And the concept of having preservation agents in all cosmetics, lipstick, serum, cream, sunscreen, whatever, that's very important so that you don't get contamination of the product. So I think, of course, the word clean sounds good and the word dirty sounds bad, but I think that we had a little bit of a confusing period in the 2010s to 2020 era where clean was all the rage. But what we really want to think about is how do we keep harmful ingredients like benzenes out of products. So we want to have minimization of artificial dyes, minimization of harmful
Hmm.
preservatives, and maximization of efficacy, and still with the presence of some kind of agents that will keep us from having microbial infestation of products. In general, I don't like the term clean beauty because I think it oversimplifies something that requires more nuance. And I think your experience echoes what a lot of people are saying. Sometimes products that are clean beauty are all plant based, made on the dining room table. And it's like really the dirtiest thing that you could imagine. The regular medical grade product is intentionally designed with science and ingredients first to keep it form stable at room temperature for the duration of using the entire bottle.
The sort of ingredients to avoid that I resonate most with are the endocrine disruptors. Are those has that been a factor for you in terms of, any of the ingredients that you've included or chosen not to include, or what were the things that mattered to you in terms of like what not to include?
Yeah, we wanted to avoid endocrine disruptors. We wanted to avoid ingredients that were not adding value to the products. And we wanted to also avoid some of the areas that have become more buzzy in recent years, but actually are not great for patients. Like, for example, bioidentical hormones, phytoestrogens, like products that can have an impact on human health, but when they're not delivered as drugs can be harder to measure and harder to understand. But parabens, sulfates, polymers that are not adding value to the products, these are all things that we've thought about. We've made all of our packaging glass componentry to avoid leaking and leaching. We use recyclable components. The environment is very important to me, and the idea of minimizing exposures is very important to me as well. But I think we just have to keep it in context. You'd never run a quote clean kitchen with no bleach, right? Because you need that to sterilize the pans and pots if you're at an industrial kitchen. So in the same way, you can't really mass manufacture medical grade products without having some degree of preservation of the product.
Fair. Okay. So for those people who are not like me and have the mental load for a more robust skincare routine, and again, this is where I hope to one day grow to, but right now it's like impossible for me to extend my skincare routine beyond like 2 products. But for those people who do have the interest of making sure that their skin routine is optimized, what do you recommend as like start to finish what you should be doing in the morning and at night? And sort of maybe that's a blend of your products and other products through other brands. Like, what does it look like for you? And what do you think, maybe you're not even the ideal user or consumer yourself. Like what do you think is the ideal state? And then maybe how does that sort of reflect in your day to day?
To make it easy, here's how I would think about approaching a skincare routine. First of all, you want to think about correct layering of products. So regardless if you're using my brand or any brand, I think mine's the best, but I'm biased. But you want to think about actives first, then serums, then creams, then SPF, and then makeup. So whether it's morning or night, you first cleanse the skin and then you put on products in that order to harness the greatest potential for absorption of the products. The next important thing to think about is the idea that the use of the products themselves is more important than their exact order. So if you forgot the first thing that I said already, don't worry, because it's almost like eating food in your diet. You want to make sure you have protein and vegetables and dairy and carbohydrates. And, if you eat it in this order or that order, or you blend it in a smoothie, on some level, it does not really matter. You should do what works best for you, because one thing that we know is that the best skincare products are the ones that actually end up on your face, not the ones that overwhelm you and end up in the drawer because you can't remember to do your routine. So that's kind of my second point. My third point is that people, generally speaking, need to think about being a little bit more delicate with their tissue. And I think one common mistake that people make is being excessively aggressive. Whether you have sensitive skin or not, you should think about the skin as a beautiful cashmere sweater that you only have one of, that you have to wear every day forever. And so you want to not only avoid getting stains on it, freckles, sunspots, damage, etc., but you also want to think about appropriately cleaning it in a way that is gentle and not overly aggressive, and maintaining it so you get improved turgor and improved thread count of the sweater, as opposed to, pouring bleach on it and getting holes in the sweater. So the concept of a dynamic equilibrium in skincare is very important and is sometimes lost because people will vacillate between totally neglecting their skin and letting it all fall apart, and then like trying to play catch up and being extremely aggressive and doing at home peels and lasers and all sorts of stuff that's too much. So, with that being said, I can go through an idealized regimen that is going to vary from person to person, but I'll make it a little bit brief so as to, minimize the pain for the listeners. But I think to me, I could talk about this stuff all day. I like think it's the most interesting thing in the world, but I don't want to blather on. So in the morning, you want to use an advanced lauric acid cleanser. That's a gentle cleanser that will not overly strip the skin. You want to start in with a hyaluronic niacin panthenol serum to hydrate the tissues, improve barrier protection, build collagen. Next, you want to think about the periorbital area, which is the thinnest skin on the body. So a polypeptide eye cream, ours is really amazing. It contains multiple plant-based phytopeptides to improve the turgor of this thin skin around the body. If skin gets too thin, you see all the imperfections. So you want to keep it kind of more rigorous. Next, SPF BB cream. I love our zinc and titanium based SPF 44 product. I wear it every single day, whether it is sunny or not. This just reduces environmental exposure from the sun, which is like a giant ball of radiation in the sky, and we need to protect ourselves. Lash serum, platinum long lash, lip plumper. Sometimes I wear a little makeup. Like for you today, I put on some lipstick. And so that's my morning routine. At night, I'll use our microdermabrasion scrub as a physical exfoliant, alpha beta hydroxy pads as a little chemical exfoliant, and then go in with vitamin CBE ferulic serum to help with hyperpigmentation. I'll use our retinol bakuchiol serum for fine lines.
So you're doubling up on
turnover.
those serums. You could use 2 serums.
Those ones I use at night. Yeah, I use 2 serums. And then our intensive pigment corrector, which I think is truly the most innovative product on the market right now. It contains tranexamic acid, kojic acid, arbutin, ergothioneine, vitamin C, and niacinamide, which are 6 ingredients to fight pigmentation changes. I think there's a lot of evidence that suggests that pigment irregularity ages the face. So keeping it nice and smooth makes you look young and healthy, which we like. And then I'll use my niacin squalene neck cream, resveratrol niacinamide rich cream. I mean, this is my profession, and I think about this stuff a lot. I know this routine is maybe more than every single person can do. But when you see these guys talk about longevity, people call it biohacking and they think it's so cool. And when you hear women talk about longevity and protecting your own assets, like your skin and your hair and your lashes, people think it sounds superficial and vain. So I think we have to examine that premise, because we're all here trying to not just extend our lives, but to improve the quality of the lives.
I mean, I think that it's an inside out, outside in approach. You have to sort of attack longevity from all angles, and to only focus on one sort of aspect of it is a good start, but it doesn't necessarily encompass everything. You can't talk about skincare without talking about your diet and how you sleep and how you move and sweat. And again, of course, we're talking about the products that you use and sort of the outside in approach, but the inside out approach matters as well. And so oftentimes I think people choose a side, and you can't be sort of one-sided when it comes to the equation of longevity, I think. But I agree with you. To your point, it's not a matter of vanity or superficiality. It's sort of trying to sort of maintain your youth as long as possible. I think that translates also to the sort of mental perception that you have of yourself as a youth. It's not only about like having other people perceive you as young and that being the win. It's also about when you look at yourself in the mirror, feeling like what you can achieve is what you achieved in your 30s and your 40s, and like not letting the sort of typical connotation of aging sort of take over your mindset of what you can or can't do. And so I think there's the psychological behavioral component of skincare that often gets overlooked. Again, going back to your point, it's like there's control. There's control in this like path. And how can we, for those things that we are able to take control of, in order for us, I love that you're now recording me, in order for us to like feel good about that path and not feel like health just happens to us, but that we have real onus as to where our health trajectory is going.
Yeah, we have so much available to us now. We're very fortunate. Obviously, healthcare can be improved, and the United States is sort of having a little moment of reckoning about that. But we have so much available to us to help us in medicine and science, not just to look better, but to feel better and to be a little bit more proactive and
Yeah.
preventative about health. So, when we were talking about some of my passions and what I focus on, I really think that the idea of being vertically integrated as a plastic surgeon must encompass the full spectrum of the most to the least invasive procedures and an entire topical approach to the skin. Because if all you have is a hammer, then everything you see is a nail. If all I do is surgery, then I am getting out the scalpel for every patient. And everyone is different and everyone has
Yeah.
a
And I
process.
think what's also really amazing about this idea of, a plastic surgeon building a skincare line is this is your way of democratizing, access to anti-aging cosmetic care. You know what I mean? Like not everyone can afford Botox maybe, and definitely not everyone can afford Botox with the best of the best. I know now there are companies that do just Botox. And that's like a whole other conversation of what to be wary of when you are, considering getting Botox from one of those places. But I think what's amazing about what you're doing is you're saying there's a way to avoid or at least minimize the need for some of these procedures by just taking really good care of your skin, by taking good care of your diet, sort of by, doing all these other things. That's where the proactive element really, really helps sort of again minimize cost and maximize outcomes.
And also just to really fully actualize our purpose as physicians and surgeons, because, ultimately we want to innovate toward obsolescence. If I am the super best plastic surgeon that I could ever be, I want to work myself out of a job on some level. Right? I want to treat the people who need treatment and the people who don't. We want to help them age in a way that they defer or decline the need for procedures with the passage of time. And I would argue that that's the purpose of all aspects of medicine. In the truly most healthy societies, if you can even imagine a theoretical world like this, we would not need doctors, right? Like doctors should work themselves out of existence. Maybe we would have people available for emergency situations and so forth. And obviously, this is a utopia dream scenario. But I think one day I was inspired to start a Substack, which is fun. It's a fun little exercise for me. So read my Substack if you want my thoughts. But my first article that I wrote was called Innovating Toward Obsolescence. And it was just some of my thoughts about how the best, highest way to be a very, very functional plastic surgeon is to do the least needed to make somebody happy in the most effective way. And if we can slow down the rate at which we climb rungs on the aesthetic ladder, then we're doing patients a service. Even though it may be the most fun possible thing for me to do these complex surgeries, and to develop my line of surgical instruments, to do my zip stitches, and I love operating. But if we think about it in the long view, nobody wants to jump on the OR table. Right? We want to have cardiologists who can place stents for heart attacks, but we really want a society where we don't have so many people having.
Wait, this is a really interesting sort of pivot because I hear you altruistically. Like, I think that that would be a beautiful thing if all doctors were inspired to work themselves out of a job. But I think more often than not, you see not just surgeons, but sort of the healthcare system as a system, they created a model that incentivizes volume and more procedures because that's how people within the healthcare system make money. So how do you think about like almost realigning incentives such that, we could sort of all be on the same page as to what the ideal outcome would be? Because obviously surgeons make more money when more extreme procedures are recommended or, needed. So how do we then get more surgeons to be like you? I mean, this is I've never heard a surgeon truly feel this way about surgery. And of course, there are surgeons who, like I know orthopedic surgeons as an example, the best ones are the ones that say you don't need surgery. And you know that that means that they're an amazing surgeon. And so, and when you find those people, you're like, wow, like that's amazing. When you think about like the industry sort of broadly, and maybe it's sort of going into insurance and like how insurance reimburses for these things, how do you think about like what the right model looks like?
While surgery is an N equals one experience, healthcare is a millions at a time experience. And, when you think about this through the lens of epidemiology and biostatistics, we want to help people, society as a whole, change its patterns. And in my field, I see this through the lens of the younger generations aging in a completely different way. People who are more proactive in their 20s and 30s about concepts of facial aging and tissue aging are going to be in a vastly different situation when they're 50 than their parents' generation and beyond. And so I think the best way for doctors to think about their role is to treat patients one at a time in the best way possible for the person in front of them, which realistically speaking, right now, we're in a treatment-oriented society. We are not in a prevention-oriented society. But these larger things are generational shifts as the zeitgeist changes. Kids today in their 20s don't like to drink alcohol. They think that we thought our parents' generation was nuts for smoking cigarettes. Kids today think our generation is totally nuts for drinking alcohol. Their kids would never dream of vaping. And the generation after that, it happens a little bit at a time where every generation stands on the shoulders of those who came before. And I do think that there are many ethical and good people in this field who do think about a light touch and a minimalistic hand, and we should lean to those people as thought leaders to help shape how we think about American health.
Amen. I agree. And
there
I agree. I think it's a hopeful sort of way to wrap up the conversation is just, it's hard out there in this world of healthcare. And I do think it's evolving in the right direction. We got to grab those people who are, having the right voice and sort of promoting prevention as a way to uplift an entire generation, as opposed to sort of only thinking about it from, a micro lens. So thank you. This was an amazing conversation. I feel like people will leave with like actually tactical steps to improve their skincare routine and also just like nerd out on some of the, vocab that was thrown around and start Googling what all these things mean. So I'm appreciative that you were able to sort of get into those details because I do think our audience really appreciates that and wants to feel empowered to understand, what the ingredients should be when they think about their skincare routine, not just sort of being drawn to the marketing or the branding of a product, but really sort of the ingredients themselves. So I appreciate you sharing all of that and also just sort of your honesty and thought around how the industry is evolving and, how you see your role in that, because I think you are a thought leader and it's inspiring to talk to someone like you who just has such big ambitions beyond what you do, even in a day-to-day. So thank you for joining us. Thank you for sharing all of your insight.
You can find me on Instagram at Lara Devgan, MD, Lara Devgan, MD, and the skincare line at Dr. Lara Devgan, DrLaradevgan. And either one of those places, you'll figure out the rest from there. We'd love to offer any of your listeners a 15% discount off of any products from my skincare line, including the amazing ones mentioned on this podcast. So you can use code THELANBY, THELANBY, for 15% off.
Amazing. I am ordering some stuff right now. Thanks for tuning into this episode of Get Well Better by The Lambie. Your support truly means the world to us. Make sure to subscribe on YouTube and Spotify or listen wherever you get your podcasts. Follow us on Instagram at The Lambie for behind the scenes content and updates. We would not be able to grow without your support and referrals. So please send this podcast to a friend, a loved one, anyone who you think is interested in learning more about health and wellness and navigating this maze of an industry.